If you were broke, my love don't cost a thing.
Welcome back. Are you looking to improve your shape? So many people are looking for perfection, from what they see on TV to magazines to online.
That's right. Now, one option to consider could be enhancing your look surgically. And here with more on how you can do it is Dr. Lane Smith. Good morning, sir. How are you?
Hey, good morning, you guys. Good to see you again.
Nice to see you.
So we see Kim Kardashian getting a ring the size of Montana. We see Jennifer Lopez, Kim Kardashian, they have assets and a form that is tough to achieve. Can you achieve those looks naturally?
Well, some people are genetically,
Gifted.
Yeah, and they certainly can. But other people need some help, and we can definitely help with that.
What's the most common procedure women have, and even men?
Well, the most common procedures are injectables, but the most common, what I would consider a real surgery is breast augmentation for women. That is the most common in the United States.
J-Lo, I thought, just always kind of had it. But Mark Anthony says he's saying that he's going to write this whole tell-all blog or a tell-all book rather about Jennifer Lopez's alleged enhancements. Do you believe this is true, or?
Well, I think I don't know for sure, but I imagine he's probably not lying. I can't say for sure, but I mean, what she's most famous for is her
butt. I'm just going to
booty.
say
Yeah,
it.
if you can
Her
say
butt.
that. And what he is alleging is that she's had over $100,000 worth of of surgery. I mean, he's alleging that on her booty. So.
And of course, a lot of women want her figure. We don't have it, and so. But that is one way to get it. And how simple is that procedure for you, since you do it?
Well, I mean, it takes about an hour and a half to do. It's not super long. I mean, what Mark Anthony's saying is that she had specifically implants.
Okay.
There is more than one way to enhance the buttocks, but implants are certainly one way. I did bring one for you to see, but this is a buttock implant.
Wow. This is what it looks like right here.
Yeah, this is a kind of a medium-sized one, and it's made out of silicone. This is really great for women who are really thin and want to have a larger
posterior.
Yeah,
you could
derriere, whatever you want to call it.
Is it just like in sizing? Is it sort of like a small, medium, large?
Yeah. There's many sizes. Yeah.
What you want. And again, this takes you how long to do?
Takes about an hour and a half to do.
That's all it takes to get a new figure.
Yeah, to get a sexier booty. Sexier
people were
buttocks.
saying Kim Kardashian's rear end could never have been real. It's impossible. So she got a little defensive. She went under an X-ray with the bum.
Right.
Do you think, seeing the X-ray, if you see it, do you think it's real?
Well, I mean, what she's done is she's released an X-ray and says, I haven't had any surgery. Quite honestly, the X-ray proves that she doesn't have buttock implants.
But there are, like you said, other ways to do it.
And
what are the other ways?
It doesn't show that she hasn't, and I don't know whether she has or hasn't, but I mean, you can do fat transfer, and that's actually the way I prefer the best, if there's enough fat to do it. You can move fat from one area to the buttocks, make the buttocks bigger and rounder, and that would not show up on an X-ray.
Oh, I saw that episode, so I believed her. And then she took the X-ray and gave it, showed it
everyone thinks that if you get this X-ray, it's somehow, if it doesn't show an implant, it doesn't mean that she hasn't had surgery. I'm not saying
it's a conspiracy. There's a conspiracy.
But you said you take a transfer, so you take it from, what do you take it from? If you have like stomach area, the arms, and then you move it, or what
usually from the waist. Because as the waist gets narrower, just that alone makes the buttocks look bigger, and then and from the stomach. So you get the tummy narrower, the waist narrower, put it in the butt, and it looks great. But it won't show up on an X-ray.